So with the ability for the virus to enter the community, a number of things will change in our approach, as detailed in our Safe Transition Plan released last month. With eased border controls, quarantine-free travel will be possible with COVID-positive jurisdictions, both international and interstate. But in order to achieve the outcomes in our modelling, we will still have reasonable and sensible controls when it comes to testing and vaccination. So firstly, with regards to international arrivals, they will still be required to return a negative PCR test result within 72 hours prior to departure and undertake a PCR test within 48 hours of arrival in Perth and on day 6. But if they are double vaccinated, there will be no requirement for quarantine. Unvaccinated, or those who have not had an approved vaccine, will still be required to undertake 14 days of quarantine, whether in a hotel or at the designated Commonwealth facility when it comes online. And there will be a cap on the unvaccinated, one that is significantly lower than the cap now in place for international arrivals. It should also note that any international border arrangements after the transition date will of course be subject to the Commonwealth Government's biosecurity settings. Secondly, domestic arrivals. All domestic arrivals into WA must be double vaccinated unless ineligible or medically exempt. I repeat, all domestic arrivals must be double vaccinated. For travel, proof of vaccination requirements will apply for anyone aged 12 and over. We'll also have testing requirements for those arriving into WA based on the length of the trip. If your trip into WA is for 6 days or more, you must receive a negative PCR test within 72 hours of departure and undertake a PCR test within 48 hours of arrival into WA. If your trip into WA is for 5 days or less, you must receive a negative PCR test result within 72 hours of departure. But you will not be required to undertake any tests on arrival in WA. And if you are in Western Australia, leaving the state and returning within 5 days or less, for example, going to Melbourne for the weekend, you will not need to undertake a test before returning to WA, but you will need to undertake a PCR test within 48 hours of arrival once you are back in WA. This information and clear charts will be available online soon that detail all of the requirements. The G2G system will continue for the time being to help manage these testing rules. And I want to stress, these are interim arrangements based on the current health advice. They will be reviewed regularly, including a specific review 4 weeks after the transition date. But it's important to remember, if you're travelling and you're experiencing symptoms, you should get tested regardless. And other states will have their own requirements in addition to ours that you will need to familiarise yourself with and adhere to. While testing and vaccination requirements on arrivals will slow the entry of the virus into Western Australia, it will still inevitably enter the community. We will retain strong test, trace and isolate measures to combat the virus, meaning there will still be public health measures in place. With strong surge capacity for contact tracing, WA's unique position of zero COVID and a 90% vaccination rate means border controls can ease with minimal community restrictions compared to other jurisdictions. At transition, we will not require capacity or gathering limits. Proof of vaccination will be required for entry at nightclubs, the Crown Complex, the 4 major stadia being Optus Stadium, RAC Arena, HBF Stadium and HBF Park, and at events with 1,000 or more patrons. For venues and events, proof of vaccination is required for anyone aged 16 and over. Other businesses may also choose to have proof of vaccination requirements as a condition of entry to protect their staff and patrons if they wish.